Good evening and welcome to our City Council meeting for Monday, October 19th, 2020. I'll now call this meeting to order with a roll call from Madam Clerk.
Miller.
Here.
DeBoer.
Here.
Cruz. Harding.
Here.
Dara.
Here.
Sires.
Here.
Dunn.
Here.
Councilmember Cruz, absent, Mr. Mayor.
Thank you, Madam Clerk. And I will ask, for those of us who aren't going to be speaking tonight, it might help with the echo if we have our mutes on. We're having a problem earlier in meetings with the council chambers with an echo, but it might be another area too because we were just doing okay a few minutes ago. So with that, looking at the meeting tonight, we are holding this in accordance with the Iowa Public Information Board electronically due to the COVID-19 counts that we're seeing currently. And with that, I'll look for a motion to approve the regular meeting of October 5th, 2020. A motion and seconded. Any discussion from council? From public? Just a moment. Okay, so all in favor say aye.
Aye.
Opposed? All right, so are there any agenda revisions tonight, Madam Clerk?
I have no agenda revisions, Mr. Mayor.
Okay, thank you. That brings us to old business to start for item 2, which is passing ordinance 2974, amending Chapter 10 for garbage and refuse of this Code of Ordinances relative to refuse rates upon its second consideration. Is there a motion to approve?
So moved.
It's been motioned and seconded. Open for any questions or comments from the public. And Mr. Steen, go ahead, sir. Name and address for the record, please.
Yes, Jim Stain, 2215 Clay Street. And on this particular motion, could someone review? Because I heard that it's not just for 1 year, but the rates will be raised the first year and then also the second. And I think it is a total of 5%. But is there any indication of how much additional revenue these increases in the garbage rates would bring in? So there's a couple of things there. One, is it for 1 or 2 years, and is it 5%? And second, is it a matter of bringing in an estimated amount of additional revenue?
Okay. So I understand, Mr. Stan, you're asking about whether it's 1 to 2 years, whether it's a 5% increase, and then the last question, I believe, was what the estimated revenue increase was going to be compared to. Thank you.
Yes.
So I'll turn that over to staff. Do we have any information we can provide for Mr. Stan on that?
Mr. Mayor, I can probably start, and then if Lisa has more details, she can add it in. But in the presentation that was at the committee, it did show that for the regular residential routes, that there is a 2.5% increase each year for the next 2 years. That's what's proposed. So it showed for each of the size carts, well, for the smallest cart, the current rate is $9. After the 2 years, it'll go up to the $9.46. For the largest cart, current rate's $26.50, and by the end of the second year, it'll be at $27.84, and that's the monthly rate for the residential route. Keep in mind, there was also increases proposed not just for the residential routes, but there was various things as it relates to transfer station, commercial dumpsters. So again, there was a variety of rate changes, and again, those are all listed out in the presentation that was provided at the committee as a whole. I don't have off the top of my head total revenue changes, but again, why we were looking at refuse rate increases is to ensure that the refuse fund can continue to sustain itself. And, looking at operating costs, future capital costs, etc.
So, thank you. Any other questions from the public or comments from the public?
Mr. Mayor, if I could just add one thing onto that is,
Yes, please, Mr. Dean.
just so everybody is aware, this is the first time that rates have been addressed since, I believe, 2008. So it's been about 12 years since we've actually adjusted these rates.
Okay, and as I understand it, these rate changes are simply to account for costs. It's not to bring in additional to the revenue to the city, but just to cover its own operational expense, correct? So it's not like I'm meant to be a profit generator for the city.
That's correct.
All right. So, seeing no other questions from the public, any questions or comments from council? Okay, so it's been motioned and seconded, and this requires.
I think Kelly has a question.
Oh, yes,
I do.
please.
I'm sorry. I'm sorry.
Councilmember Dunn.
Okay, I just have a question about the issue of the 10 things on the curb, and then that's $10, and then the additional items are $10. Does staff feel like, my concern is that abused? I mean, is somebody putting like 50 items out and expecting to get it picked up for $20?
I think I'll jump in and then I'll let Mr. Schrage. I don't think it's abused currently. I think we do have occasions where that happens, but I also think that that could happen right now for the cost. Mr. Schrage, is it $5?
$5, yeah.
Okay, I just didn't, because I don't know, I just don't want. Does staff feel like there's the manpower to continue to? I just don't want staff and our city services to be taken advantage of. So if staff feels like it's cool and we're not being taken advantage of as far as that service is offered, then that was my only question. Thank you.
Okay, so I have an idea too in council chambers for Councilmember DeBurr. If the phone has a mute on it, just on the device itself, that might stop our echo. And then when you want to talk, you can just hit the unmute on that phone. I think it has one of those.
Would that be the microphone with a line through it?
Correct. So we'll give that a try. All right, thank you so much. And that, I'm getting no echo now, so that's great. Feel free to hit it whenever you want to talk again, though. So it's been motioned and seconded, and this requires a roll call vote.
Harding,
Aye.
Dara,
Aye.
Sires,
Aye.
Dunn,
Aye.
Miller, DeBoer,
Aye.
all voting aye, Mr. Mayor.
Thank you, Madam Clerk. The next item that we have is item 3, a resolution extending the face mask mandate adopted by Resolution 22097 on September 8, 2020 for the city of Cedar Falls. Is there a motion to approve? Okay, it's been motioned and seconded. I'll open it up first for public comment and then for council discussion. So going through, we have President Nook from UNI. So go ahead, sir. Name and address for the record, please.
Yeah. This is Mark Nook, president at the University of Northern Iowa. I live at 2501 College Street. And I am speaking on behalf of the university this evening. Again, thank you, first of all, to the council for approving this mandate 6 weeks ago. We really appreciate that, and we think it's had a big impact and effect. And also for considering it again tonight, its renewal for another 6-week period. I want to just talk about a couple of things that I've noticed. One, the new Iowa Department of Public Health guidelines that were put in place recently put a giant exclamation mark on the use of masks. in that publication, they said that you wouldn't have to quarantine if you were near somebody that had the virus and both of you were wearing masks, even if you were within 6 feet for more than 15 minutes. It really does show how important the Iowa Department of Public Health believes that the face coverings are as long as both of you are wearing them. Here at the University of Northern Iowa, when that mandate came out, we wondered what it would really mean, and we're a little bit nervous about implementing it, but we do not get to make the choice of who we put into quarantine. That's made by the Department of Public Health and also by our county public health department. But we did have some data that we looked at to see what it was like. And what we know is that we had several students, a group of several hundred students that we had to quarantine because they were sitting in a classroom within 6 feet of a student who tested positive for the virus. So they spent an hour with at least another student within 6 feet of another student, and so we quarantined them. As those students were moving through quarantine, really out of an abundance of caution, we tested each of them for the virus. And what we found is that less than 1% of those students who spent more than an hour with someone who had the virus, but both people were wearing masks, less than 1% of them ever developed the virus. And many of them had contact with other individuals, so it's not really clear where they may have contacted the virus. But we know that you've got at least a 99% safety effect from our data if you are both wearing masks and you spend 15 minutes or more in contact with a person with the virus. It's really strong evidence that what the Iowa Department of Public Health has put in as their new guidelines for quarantine are really right on and very, very effective from our own data. The other thing that I want to share is that as I've been around the community and walked into the various stores, and one of them just shortly after the mandate was passed 6 weeks ago, a convenience store in town, they had a sign up that said you needed to wear a mask, and a couple people entered the store without the masks, and the person that was working behind the counter asked each of them as they were leaving the store, reminded them that we now have a mandate in the community, and next time please wear a mask. And in both cases, those customers said, thank you, I didn't realize, I just didn't know. And they said, yeah, it's just something you've got to do if you want to be in the store here in the community. And they said, thank you, and walked out. It wasn't an intimidating encounter at all. It's pretty clear that the mandate was giving our business owners the ability to reinforce and to recommend and encourage the wearing of masks and to cut the spread. It's very clear to me from our data, from what I've seen around the community, that the mask mandate is having an impact. I'm seeing more and more people wearing them in stores around town. And from our own data, we see that a mask ordinance really is effective at limiting the spread of this virus and allowing us to keep our businesses, our schools, and our community opening and functioning. Thank you.
Thank you, Dr. Nick. Our next speaker will be TJ Fine. So go ahead, TJ. Name and address for the record, please, sir.
TJ Fine, 1319 Austin Way. I just was curious if we had any kind of data for the last 6 weeks, good or bad, as how the mandate started. The previous speaker mentioned 2 people wearing masks and not having to quarantine. That was a recent guideline that came out. It also proves that just because you, wear a mask, you're not going to get sick. So just kind of wanted to point that out. I fully anticipate that council is going to extend the mandate. I wish they didn't, but I just hope that they look at it and maybe make some tweaks, some common sense tweaks, as far as making some other exemptions in addition to the few exemptions that already exist. One of the exemptions would be 2 non-household members riding in a car together. Per the mandate, they'd have to be required to wear a mask, and we're just about to hit the holidays where people are starting to get together with their families. So I would like to see if council would would make an exemption for that. I spoke with a couple of bank tellers and some late night hour convenience store employees. Some of them have mentioned the possibility of having like a safety exemption, maybe because they said that they feel a little bit uncomfortable with people with masks coming into the store because of the potential for violence. Very, very small percentage of the chance, but still a chance that they don't really want to take. Also, another exemption that I would like council to consider would be the restaurant exemption. You can sit and eat and drink without a mask on, but getting to your table, you have to wear a mask. That seems a little bit silly. To me, anyway, the tables are distanced. People are asked to keep your distance. Most people are not waiting, in my experience, aren't waiting for a long wait to be seated at a table. They'll just go somewhere else, or maybe the wait's not as long. So you have distancing that way. At the end of the day, I guess I think what the most important thing is emphasizing the respect we have for each other, whether we agree or disagree. It shouldn't be a point of contention in the community like it has been, kind of going back and forth. Nobody's, it's a lose-lose kind of this mask mandate to be in place. As far as community divide. But I think it's important at the end of the day that everybody respects private businesses' decisions as well as private citizens' decisions. So that's all I got. Thank you.
Thank you, Mr. Frank. I see Penny Pop. So go ahead, Penny, name and address for the record, please.
Good evening, Mayor, Council. My name is Penny Pop. I live at 4805 South Main. I just wanted to talk about how I support the mask mandate. And I'd like to tell you a quick little story. Today, as well as last Monday, I do a lot of volunteering at the food bank. I met a young man who attends UNI, and we had a chance to talk about the effects of the mask mandate at UNI, as well as in the cities of Waterloo and Cedar Falls. And we both understood how important it was for both cities and our whole county to be cooperating together to get us back to some type of normal life and activities. So again, I just want to stress that we need to continue this mask mandate, not just for you or for me, but for everybody in the community, because it has affected us all in different ways. Thanks a lot for your time.
Hello? Rob, you're muted. Who's speaking now? This is Jim Skane, 2215 Clay Street.
Go ahead, Mr. Skane.
Okay. I spend a lot of time with COVID-19 statistics, and I don't know if people are aware, but in the last week or two, the number of cases in Iowa have really spiked, and the number of deaths have really spiked. There's over 100,000 cases. I think it's 106 or 7,000 cases as of today, and there's 1,536 people who have died. Now, I think that the mandate that was passed for Cedar Falls is not really effective. I live on Clay Street, and there's pedestrian traffic. I have yet to see a person who has walked by my home that has a mask. And then I see when they show pictures of places like New York City, which has a infection rate of about 1%, everybody has a mask all the time. And in Iowa, the positive rate right now is over 20%. Now, this means that what's being done and the enforcement of the mask policy is not doing the job, because people think that if they're outside, they're not infectious. But the experience of places like New York State know that the infection from COVID-19 is everywhere. And it seems to me that this business that we put it on the honor system is not working, especially in a time when we have had these spikes. Now, I've listened to Channel 415 and 15, and they do have these public service announcements, but your communication director, I think it's Huseman, says I wear a mask for this reason, and I wear a mask for that reason. But there's nothing that communicates to the people how serious the spikes are and how many people have died. I think the number who died today was at least 6, and I've seen days recently where there's been as many as 14. Now, sometimes you can get numb to the numbers, but the mandate that has been passed, I think, is more effective because of what is happening at the University of Northern Iowa. But that's I think the only place that the mandate is consistently put into operation. I mean, this is important, and deadly people, business people, and this business about people having a First Amendment right to, not wear. What did you say, sir?
1 minute remaining.
Okay, good. What is happening? I mean, for instance, there should be public service announcements. If you do this and this, you should check with your doctor or check with the hospital. But there's nothing like that. It's just this feel good. I wear a mask because of this or that, the other thing, and we certainly don't know about contact tracing in Cedar Falls, except they do it at the University of Northern Iowa, and as a result, they have a low positive rate, even if people are coming in contact with people who test positive. So,
I do have you at time, Mr. Skane.
Pardon?
I do have you at 5 minutes.
Okay, well, let me have one sentence more. If you pass what you passed before, it'll be not effective. There's no reason for it to be effective. That's all I have to say.
Okay. Thank you, Mr. Skane. And
you're muted again, Rob.
Thanks. It's myself. So before going to the next commenter, there was just a point of clarification with the previous speaker. He said that he didn't see people outside with the mask on. And just to clarify, in case somebody else from the public is going to want to talk about that, the current resolution doesn't require wear outdoors unless you can't be apart or 6 feet apart from someone else. And if it's someone from the same household, so even if it's 2 roommates together, they can be together without masks on walking down the street. And I do that with my family often. So it's only when you are going to encounter somebody not in your household that you do have to wear it outside. So with that, I'll open for Mark Eel. So name and address for the record, please, sir.
Hi, this is Mark Eel, 2308 Primrose Drive, Cedar Falls. wanted to start out by saying I'm not opposed to doing what we can to protect the vulnerable among us. I'll mask up when I can't social distance, particularly indoors. I do have several questions I think should be addressed as part of the council discussion before an extension vote takes place. So I'm going to kind of roll through these, and then hopefully some of these can be addressed as part of your discussion, particularly if you think they have not been addressed before. So the first question I have is, are there any data-based criteria for continuing or discontinuing the mask mandate? I would prefer if it was not only time-bound and then subject to who knows exactly what to either continue it or not continue it. You know, basically the impression of how bad it is. It just seems kind of capricious in both directions, to continue it or discontinue it. Secondly, can you clarify if the mask mandate applies to city facilities? And if so, can you explain if any of the city facilities deviate from the city's mask mandate and why? The third one is, if you could explain why we have a mask mandate, yet we do not have any kind of hand washing mandate. Fourthly, since it seems that we're laser focused on cases, I'd appreciate if I could get some more information from you about the testing sensitivity and specificity. Specifically, what's the cycle threshold for the tests that are being conducted on the people in our city and the data that's getting reported about our city? The higher the CT value goes, the more likely a person is going to be given a false positive. We've seen that in the NFL a lot, where they're testing every day and somebody's test will come back positive and they have the resources and the mechanisms in place to test again. Lo and behold, the second day, a lot of times they'll test negative. It's not because the virus magically went away. The first one was a false positive. To go along with that, what's the likelihood that the tests in our city are either type 1 or type 2 errors, meaning a false positive or a false negative? It'd be great to know that, because then we'd know what, if any, of the data points that we're basing, well, we're not basing decisions off of them systematically, but it'd be good to know that so that we know if we have any faulty data that we're basing decisions on. Third would be, is there any evidence, not anecdotes, but evidence that our mask mandate has having statistically significant positive impact on case counts? And then finally, would it make sense to use some type of hospitalization rate or even the death rate to be factored into the decisions for whether we should keep the mandate in place or rescind it, as things hopefully at some point in the future improve? It feels like cases alone might not be the best thing. We've already noticed that there's been a significant downtick in hospitalization and deaths compared to how many cases we're having, so it might make sense to have a little bit more of a hybrid model rather than focusing solely on the case counts. Thank you for your time.
Thank you, Mr. Eel. And so those will be addressed during council discussion. Moving on to next speaker, we have a phone number ending in 6601. So name and address for the record, please. I've got you unmuted. Here we are. Go ahead.
All right. Hello, my name is Rick Sharp, 1623 Birch Street, Cedar Falls. So,
hey, Mr. Sharp, go ahead, sir.
Yep, I have no problem with the mask mandate. I wear a mask regardless. I have some pretty cool ones, so I like to show them off. My question / confusion is the going back and forth of why the council goes back to video televised meetings when the COVID infection rate, exposure rate, hits a certain number that somehow determines that it's not safe to have live in-person meetings. And I look at it like council meetings are usually lowly attended, low attendance. You have the masks, you have the partitions, you have the chairs evenly spaced apart, social distancing. So I consider that a low-risk, low-exposure mode. Yet you decide we're not going to have in-person council meetings. But at the same time, that same level of risk, the COVID risk numbers, what have you, we still allow
Mr. Sharp,
public.
this discussion is about the mask mandate itself and not.
Well, this plays into it. This plays into it, though.
Okay.
So, why is there such a different standard that we're going to mandate masks and openings to when you have a higher risk of exposures and allow businesses to stay open, but yet we won't do the same thing here? I mean, they all go together. Either it's a crisis requiring the mask mandate and everything to stay open or closed, and I'm wondering why we're playing two different scenarios for the same incident. That's all. Thanks.
Okay, thank you, Mr. Sharp. Other speakers from the public, I'm seeing none. So I will turn it over to council for discussion and comment. And that could include, actually, since we're at that point, there were a few questions that came up as far as database criteria for making some of these determinations. And let's see, does it apply to city facilities? We have a mask mandate, but not a hand washing mandate. For those questions that had come up, I'll entertain if there's comments from staff on any of those that you want to start off with, that you have direct answers for, and we can move from there. So I can certainly say for the why we have a mask mandate but not a hand washing mandate, and what our guidance has been for that has been from the county public health director. So there certainly are other statistics that are out for hospitalizations and death rates and things like that. But when it comes down to it, we're basing our decisions and other communities that have taken similar actions, we're basing that on the guidance from county public health, state, or like Iowa Department of Public Health, and the Centers for Disease Control. They have recommended that cities and communities implement mask mandates. They've not done the same for hand washing. And additionally, you can imagine for hand wash or for masks, you're in direct contact with other people. With your hands, you may not be. So really, the concern is for in the public health side, it's aspiration and other aspects of masks. And other council members or staff with more knowledge on this than me certainly can chime in on that as well.
It's airborne. I mean, we should all wash our hands and we should wipe our surfaces, but the main thing is it's airborne in your spit, and that's why when we both wear a mask, my mask is protecting you, your mask is protecting me. When we both wear the mask, there's less chance we're going to suck each other's spit in and take in the virus, which I know it's not literally your spit, but the particles get in the air. It's an airborne virus.
Mr. Mayor?
Yes, go ahead.
Just to follow up on the one question that he had asked about, are the city buildings, do they have different stipulations than the city mandate? And is there anyone in staff who would be willing? I believe that is the case, yes. And I've gotten this question from a couple other citizens. Why are the city buildings or city, departments, why are they different than what this or the citywide mandate is? So is there anyone in staff that could shed some light? I don't think we're doing anything negative here in this aspect. I just wanted to get the thoughts of why city had some stricter rules, because we don't have any looser rules. We just have some stricter rules, correct?
And I do have Kelly Stern, our library director, on as well now, if she'd like to chime in, and I'll leave that to Mr. Gaines first. And to Kelly.
Mayor, thanks.
Certainly.
Oops. Let's have Mr. Gaines go first.
Okay.
Thanks. Sorry. So in the city facilities, here's the way we're approaching this. Everyone wears a mask. As you come into the city building every day, you get your temperature taken, and there's a series of questions that we ask. And so just to make sure we aren't having any of the symptoms. So Also, you wear a mask throughout the building. If you're in your own personal workspace, so for people in offices, they aren't necessarily wearing masks all day. But if someone comes in to talk to them, everybody wears a mask. If you're meeting in, if you're walking through the building and you're in common areas, you wear a mask. If you're meeting in council or council chambers or conference room, you wear a mask. So really the only exception is if you're sitting in a work area by yourself that's physically distanced, you wouldn't be required to wear the mask.
Yes, so Director Stern, go ahead.
Okay, so at the library, our policy is slightly different. It is a board policy adopted by our Library Board of Trustees. And the reason that we, as a staff, requested of our trustees that they consider requiring a mask at a lower age is because of the high number of preschoolers who frequent the library. So citywide, under 5 might be just fine, but families with children, and especially preschoolers, are really the bread and butter of public libraries, and preschoolers make up a large portion of our patronage. So to have, and we know that small children, because of studies that the CDC has posted, small children can contract the virus and be asymptomatic and spread it to others. So as a safety measure in the public library to protect both staff and visitors, because we have so many preschoolers, we asked our trustees to adopt a policy that requires masks of ages 3 and above, and that's what they did. So that, again, the trustees are our governing body. So that's our library policy.
Mm-hmm. And I'll note, too, within the resolution, I've had some questions from the public about it, particularly churches. I've had a few pastors ask about what the requirements are if they're in their private spaces, so in the office zones. And this holds true for, I believe, City Hall as well. It says in the resolution that in city buildings, masks are required, but it also talks about public spaces. And so we're considering as Mr. Gaines said, I'm in my office right now and I don't have a mask on because I'm not in a public space. Or someone who's in an office setting, if they're not around customers in the front, if they're in a back private space, that's not considered public space, so a mask wouldn't be required. And we've been trying to follow that same kind of guidance or logic within city buildings as well. So any other comments from staff on that item? There was a question that came up from Mr. Eel. He asked about the criteria that we would use to determine that the mask mandate is no longer needed. I certainly am looking for the vaccine date. That's of course a council decision. That's he makes it, but I would recommend that we have it in effect until a mask or a coronavirus vaccine is readily available in Cedar Falls. And at that point, I would think that the individual risk should drop down significantly. But that's not necessary for now. We could have council could change the resolution because currently it's listed as December 9th as expiring. We have a council meeting, I think, the 7th, so it could be extended at that point. But it's really up to the council to decide if they want to change the language to be a different litmus test. Some cities have it indefinite, some have date specific, and some put in language about numbers and things like that. So I'll leave that to council discretion on that.
Mr. Mayor?
Yes, Councilmember Harding.
I also think, like going back to your original point, or one of the original points you made about us following the guidelines of our county health board, that's, obviously a big one too when they decide, and it'll probably coincide with the vaccine, that, masks are not really a necessity anymore, that, we'll try our best to follow the advice of the experts there and follow their advice as well. So I think it'll be a combination of things as to what data we're using, vaccine, and what the county health and the state health recommend.
For Director Olson, have you seen any data or trends, I guess for Police Chief Birdie as well, as far as public safety, like altercations or incidents because of this?
No, we really haven't seen any altercations. We do get reports from time to time of people not masked inside businesses. Early on, when our city mask mandate took effect, we had a couple businesses that we had to visit because they said they weren't aware of the mask mandate, but they immediately started following in line. We also have paid a little attention to some of the nightlife establishments, and some of them are doing an exceptional job handing out masks at the front if patrons don't have them, and then some of them we don't care to remind them as well. So, but we haven't seen, and Chief Birdie can correct me, but I'm not aware of any altercations or any anything other than what I just described.
No, I would agree. I don't either.
Okay. Other questions, comments from council?
Just to play off on what was mentioned as the vaccine, I would agree that until the underlying factors change, which at this point I don't know what would change other than we need to either have a vaccine or treatment. So if neither one of those are available, then I've said this before, but it's kind of like when you treat somebody's blood pressure and their blood pressure goes to a normal range, and they think, well, now I can go off my medication. Well, unless you've made drastic changes in your lifestyle with your change in diet or eating, the reason you're probably having that better result is because of the medication, where in this case, it's the mandate that's helping to control those numbers. There was a question about data. In my experience in the clinic setting, and I know there's Test Iowa, and they might have maybe better data than that, but we need to realize that we still don't have enough testing supplies. I don't know that obviously the county health department might have numbers for that, but we're not, in the real world, we're not always lucky enough to be able to supply and test people who are not symptomatic. Sometimes that recommendation changes. Like, for instance, recently they said that for a while it was assumed that if you had a family member that was positive and you lived with that family member, you were to assume that you were positive. Now, the other day, the recommendation changed to where we should test everyone in the household. But the recommendation changes constantly, and it is really factored upon how much testing supplies we have. So the UNI data is great because they've been given that supply to test as you would want to test, where in the real world we don't have that. And as far as compliance, we all know that education is in the focus, but just as like observing people, I like to go up to the hill a lot. I like to go to the Quick Star on the Hill. I've noticed a definite change, and more people are masked. Not everybody, but more people are. And if it's, it might be because they're actually trying. It might be because they don't want to be the odd man out. But either way, I do think there has been an increase in masking, and the idea is to help keep us safe and help keep our businesses open and our schools open. And I think we all can agree we want this to go away, but until we have something that changes the underlying factors, I don't know, it'd be nice to not have to revisit this in December, that we should just change the language to be, a scientific thing, like either a vaccine is readily available, which even if it comes out next year, it's probably going to be a while before we all have it. But I don't know that revisiting it every few weeks is a good idea. It'd be nice to have a more definite scientific way to measure it.
Okay, so it sounds like that might be an amendment or a motion to amend to have a different criteria. Is that the case? So I would just need what that motion is then.
I would make a motion to amend that we keep the mandate in place until either a vaccine or treatment is available.
And available in Cedar Falls, or available, like, it just seems pretty broad.
Well,
until it's available, and we'll vote on that.
I mean, the thing is when it is available, we can vote then to extend it, right? I mean, or no, I guess.
I guess that'd be part of the discussion then. So it's been motioned to amend the language of the resolution to not be December 8th, or excuse me, December 9th, but instead to make it when a vaccine is available. So that's been motioned. Is there a second discussion?
I would second it for discussion purposes.
Okay, so it's been seconded, and we'll discuss that.
I think that I understand where Kelly's coming from, and making it so we don't have to revisit it every 4, 6 weeks, 8 weeks could be helpful. I would like to see the language possibly more specific to Cedar Falls, or possibly when a vaccine or treatment is readily available to the people in our area. Yeah, just because if I guess that becomes up to debate. What's available? A treatment's available now, people would argue. Also, people would argue that there's not a vaccine available now, but there's treatment available now. So I would try to be more specific with the language.
Okay, let's take treatment out because
you'll need to withdraw your amendment.
Okay, I'll withdraw my amendment.
Okay.
And can I make a motion to say when the vaccine is readily available? I don't know how to measure that. I mean, I'm not sure how that's measured, because I guess the public health department would be able to say when it's readily available. I don't know how it's going to get rolled out. I'm assuming it's going to go to healthcare workers and.
What about making an amendment?
We want to make sure we follow the procedural process here. So it's been motion. So I don't think you finished your motion, Councilmember Dunn. And then we can second it.
I guess to have it in place until a vaccine is readily available. I don't know how to say it differently.
That was the original. And okay.
No, I said the vaccine and treatment, so I took the treatment part out, right?
Okay. The vaccine is readily available. That's been motioned. Is there a second?
I'd second it. Talk about it more.
So now we can discuss. And I appreciate everybody bearing with me. This is just how we keep the logic going properly forward. So let's discuss.
Anybody who already had the virus has
Mr. Mayor?
Yes, Councilmember Harding.
That's Dara.
Oh, sorry, Councilmember Dara.
Simon, if you want to talk.
No, I've talked enough, man. Go ahead. You go ahead, Frank.
Well, you know me, it'll just kind of be free associating anyway, but earlier today, I had my mask on, and I met with the mayor in his office. He had his mask on. We were also about 8 feet apart. But on his wall, he had the chart, and I want you to explain it a little bit, Mr. Mayor, but your chart showed the number of cases, I think, in Blackhawk County, and not that our mask mandate made the whole difference, but from about the point we passed that mandate, for several weeks after, the numbers in the Cedar Valley, or maybe that was Cedar Falls numbers, dropped considerably. And not that we can take credit for that with the mask mandate, but that was some data, just active cases in the county. Was the data that kind of were making us feel better, and we went back to meeting together as a council. But then 3 days ago, the numbers started going back up, and
that's when you made the decision not to have the meeting together, and that's at the council chamber. So, to me, you've got information in front of you that's from the county. The county's providing us guidance. I think we just continue to use some of that data, and if it extends for that data stays low for several months, then we reconsider it. But rather than having a cutoff date, just say maintain the mask mandate until the following statistics are consistent, or further guidance from the county. But I think it's working, and I do want to say I'm very proud of the people in this community, because like many of you, as I've gone out, I see almost everybody wearing masks. A lot of people don't like it, I realize, but they're recognizing that we're in this together, and unless we all do the same thing, we're not going to get out of it for a long time. So I really want to thank the citizens of Cedar Falls for chipping in on that. But as far as any kind of criteria, I just think some of the numbers you're looking at now, and then have them maintain a certain low percentage for X number of weeks, then we consider it when that has happened. But rather than another date, move it to January 8th and talk about it again, I'd rather wait and just let the number, whatever those numbers might be, tell us when it's time to rethink it.
And with Frank or Councilor Dare bringing that up, I can show the screen for what he's talking about here. So I've shown this chart before, and I keep it updated daily. So of course, there's a big Tyson spike, and then a drop, and this is what I kind of call the second wave, this blob in here. So the Waterloo passed its mandate. This is county figures. So Waterloo passed its mandate. It went up a little bit, dropped a bit, continued up. Cedar Falls passed its mandate, and we saw a pretty significant drop. And then it was below what's kind of the red line that I follow from the Harvard Global Health Institute. That's 25 cases per 100,000. And the reason I was starting to get really concerned was looking at a couple of weeks ago, or maybe 2 weeks ago, we started seeing this number. The incline was really significant, and just in the past, since October 10th, we were above the red line of 25, and then we've stayed above that for the past 7 days. And it's not like a little spike, or I call them an iceberg, like we've had in the past. This has been consistently above. So my conversation with Councilmember Dare today was looking at, what is our metric for saying that we're doing better? And I know that, as Mr. Eel had said earlier, there's lots of data that can be used as part of this for hospitalization rates and different kinds of positivities and false negatives, things like that. I've not found a reason to get away from the Harvard Global Health Scale, which is that 7-day average of all these crazy daily up and down spikes, which still shows this and a concern. And that's something that council can address later if we want to change that figure. Like, what's the real? It sounds like he wants to use this sort of a scale to say we would need to be under X in order to consider dropping out. So that's an option. I'm not recommending that necessarily, but it certainly is one way to think about this.
Obscure.
Mr. Mayor.
Yes, good.
I got a better idea.
I would kind of lean towards the data, like what Frank said. I mean, obviously, a vaccine is readily available. It would be great, and hopefully it would lower it. But if people don't get the vaccine and our numbers stay high, there's so many things that factor into it. It may be nice to go to a number or a data-driven decision where the cases are below a certain threshold. That way we know that we're just really not at risk in our area, so therefore we don't need the masks anymore. So I don't know how we would say that. Could you put your thing back up again? Sorry, the Harvard Global Health. They recommend below below 10 is, or what's the? Sorry, go ahead.
Yeah, that's a good point. For the county, and I can bring up the county data too here, just a little bit of education. Blackhawk COVID-19, on their scale of moderate, that means that it's 50 cases per 100,000 residents in the past 14. I use past 7, or Harvard uses past 7, but it's roughly the same number. So in their case, that's 50, and then they say getting down to a lower level, it's 0 to 5 cases. So we're right here in the moderate, which is 5 cases to 50. And my comments to Dr. Ebonier on this were, that's such a broad scale, it makes it really hard to do public health or city-based decisions off of that when you have that big of a gap between elevated and high. So going with the Harvard scale gave a little bit more granularity. Let me bring that up here again. So that's where that 50 is for the county, that it's saying that it's a real risk. And Harvard and other public health professionals say that it's when you get to 25, that's when you have real major concern. Under that, it still is significant, but you're looking at I think in our city one, when I did the chart of that I sent the council earlier of when I thought things should change, I listed 10 at that point. I felt like when we're under 10, we're quite a bit safer. And if we looked at the national, here's from Saturday, red, this is all the ones that are above 25 cases per 100,000 county-wise. So you see a lot of orange in Iowa, which is 24.9 down to 10, and then the yellows are below 10. So there's not, the Northeast is 10 or below, some parts of Michigan, but most of the country is either at 10 or above. So if the country were using this kind of scale, you'd be seeing very few mass mandates in a lot of places if other counties did the same thing. And it's not until you get down to the yellows that you would see them drop away again. So it's a low bar, or it's a very conservative bar, and I have just tended to steer toward more cautious rather than less, which is why I've been more comfortable promoting the 25 scale rather than the state's 50 scale.
So if the county's low, we're moderate right now, but the county's recommendation for low is 0 to 5 per 100,000?
Yeah, we've not been there.
So we could say that we could possibly amend the mask mandate to be in effect until we reach a low 0 to 5, cases, that if we want to use data or number based rather than a vaccine based, it's an option.
Mr. Mayor?
Yes, go ahead, Councilman Miller.
I feel like there's still too much conflicting data, and there's not a real solid source of guidance. I know we're following the county in a certain regard, and I appreciate the numbers you're putting together, but in terms of the vaccine, when it's available to Iowans, some Iowans aren't going to get it, some are, and then you're seeing the caseload now, if I'm correct, the caseload's going up. There aren't as many deaths comparatively to when the virus first hit, and it seems like the severity might be changing. I just feel like there's too many, as much as I wish it could be based on a certain metric, I feel like we need to keep the mask mandate in place and revisit it again in 6 weeks.
Yeah, and just for the record, I think it's 7 weeks from today, I believe.
7 weeks.
Yeah, it was that, and that wasn't so much because we wanted 6 or 8. It's just that it was right after the next council meeting, so we'll have a chance to vote pretty quick.
I feel like we're still learning about this, and something could change in the next month, and that changes everything. So I want to see a vaccine for it by all means, but somebody says it's coming out within a month. Somebody says it's not going to be here till March. So I'm a little hesitant to put something in place on that parameter when we're still unsure as to everything that has to do with this.
Mm-hmm. So from what I heard, it sounds like we'd be okay voting on. Yeah. What's that?
I was just saying, other than the work. So let's stay the course and go from there.
Stay the course, meaning using the mayor's criteria that he's already established?
Well, I don't know that I mean, that trying to pick a parameter to follow at this point. I mean, there's certainly there's a lot of data in the mayor's stuff that the way he's pulling that together, but I feel like we need to keep the mask mandate in place, revisit it in 7 weeks or whenever wherever it works out, council schedule-wise, just like it's worded on the council packet.
Yeah, and I can tell you, as the data puller together, I keep my numbers with a sense of skepticism as well, and I wouldn't feel comfortable hanging the hat of what we're going to do just on those numbers. I would recommend keeping the council control, as Councilmember Miller said, to continually revisit it. It involves more conversation and discussion, but this isn't something that because it's so squishy, there's so much different data and so much change, I would rather see this in council's hands every 6 to 8 weeks.
Mr. Mayor.
Yes, Councilor Harding.
Yeah, I'm glad we had the discussion and I'm glad we opened this up, but I think I would agree with what Councilmember Miller said. It's a tough discussion to have and it takes time, but with everything changing so much, recommendations, even Kelly had said, the recommendations are changing constantly. I think it's good to have a hard set date where the people know we're going to come back and visit it again, and they realize that we're not just going to leave it there indefinitely. We're not just going to forget about it. We're going to come back to it and we're going to talk about it. So I think I would prefer to have, I like that date of December 9th.
Okay, so that said, there's two options here. Either this can be put on a voice vote for what was put forward as the amendment, or Councilmember Dunn, if you're comfortable with the changes and with the discussion, you could withdraw the amendment. So how would you like to proceed?
I will withdraw the amendment, but can I say one little comment?
Sure, I'll allow it. Go ahead.
Okay. We need to remember that sometimes when those numbers are going down, unless there's some other huge factor playing into it, they're going down because of the mask wearing. So I ask that we remember that. When we see numbers go down, it doesn't necessarily mean that we should just strip the masks away unless there's some other kind of factor that's so I just want to make sure that we remember that.
Okay, very good point. So we're back to the original, which was the December 9th date, and that's on the floor. So is there any final council discussion on that? And I'll ask for, in the council chambers, Councilmember DeGura or Councilmember Cyrus, do you have anything you would want to add to that?
No, just call the question.
Okay, great. So it's been motioned and seconded, and this requires a roll call vote.
Jackie, you're
Jackie's on mute.
Aye.
I apologize. Sarah? Tyers?
Nay.
Dunn?
Aye.
Miller?
Aye.
DeBoer?
Nay. No.
4 voting aye, 2 voting nay, Mr. Mayor.
Thank you, Madam Clerk. That brings us into our next item, which is under new business. We have our consent calendar tonight. And the following items will be acted upon by a voice vote in a single motion without separate discussion, unless someone from the council or public requests that a specific item be considered separately. So does anyone from council wish to pull an item 4 through 11? Okay, seeing none. And does anyone from the public wish to pull an item from 4 to 11? You can raise your hand with the *9. Okay, I see Amy Jardin. So which item would you like to pull, Ms. Jardin?
Number 5.
Okay, number 5. Great. And any other items from the public? Okay, I'll wait a moment because I heard before in the last meeting. It took a few seconds to get connected in there, so want to make sure we get plenty of time. I'm seeing none. So I'll read all the items minus item 5. Number 4 is receiving and filing a proclamation recognizing the week of October 18th to 24th as Character Counts Week. Number 6 is receiving and filing a proclamation recognizing October 24th, 2020 as United Nations Day. 7 is receiving and filing a proclamation recognizing October 24th as World Polio Day. And then 8 is receiving and filing Committee of the Whole minutes of October 5th for a library trustee interview, Great American Rail Trail, and parking large vehicles and trailers. Item 9 is receiving and filing the biennial report of Community Main Street relative to the self-supporting municipal district grant. And 10 is approving the application of G Corner for a cigarette, tobacco, nicotine vapor permit. And finally, 11 is approving the following applications for beer and liquor licenses. So is there a motion to approve these items minus 5?
Motion to approve.
Motion and seconding. All in favor, say aye.
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 Opposed? Okay, so that brings us to item 5, which is a proclamation receiving and filing a proclamation recognizing October 24th as Altrusa International Make a Difference Day.
Motion
we
to
have
approve.
Amy Jordan here tonight from Altrusa. So go ahead, Amy.
Hi. I wanted, maybe I shouldn't have pulled it out separately, but I just wanted to be able to say a little bit about our local Altrusa group.
Certainly, please.
So our Cedar Falls Club offers an opportunity to make a very real difference in Cedar Falls. We undertake a variety of service, literacy, and fundraising projects each year, including maintaining the library at Pfeiffer Park, giving away books of all ages at Farmers Market, except for this year, obviously. Choose a local group for our Make a Difference Day. This year it was Habitat for Humanity, and adopt a local family at Christmas. And then this year we also participated in the Habitat for Humanity Women Build Day. And each fall we normally hold a fundraising brunch where we award scholarships to women who are at least 22 years of age, furthering their education within Blackhawk County. And this year we were able to award 2 of those scholarships without the brunch. One is finishing her work on a bachelor's degree and wants to obtain her master's in social work. The other is completing her work to become a licensed mental health counselor.
Okay.
Thank you.
Yes, thank you, Ms. Jordan, and for all the work that Altrusa and our service groups are doing. 24th is a volunteering day. There are quite a few organizations that are doing volunteering. If you can, please participate. So with that, also I'll ask for the council chambers, if you wouldn't mind hitting that mute button again. That'll keep us from having an echo. And that brings us over. Oh, wait, yeah, so we have to approve that. So the motion.
Mr. Mayor, excuse me, it's Kevin. I'm not sure heard a motion a second before the speaker began.
I made a motion
Maybe
to
I just,
approve.
Yeah, I have motion by DeBoer and second by Miller.
Okay, so it's been motion and second. All in favor, say aye.
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 Opposed? Okay, so that passes, and that brings us over to the resolution calendar. The following items will be acted upon by a roll call vote on a single motion without separate discussion, unless someone from the public or council requests that a specific item be considered separately. Does the council wish to pull any item from 12 to 24?
Number 13, please.
Number 13 for Councilmember Sires. Any others? Okay, seeing none there. I'll go to the public and see if there's any that are wished for. So, yes, Mr. Skane, which would you like to pull from 12 to 24?
I'd like to pull 12,
okay.
13, 12, 13, 17, 18, 19, 20, and 23.
Okay, so I have 12, 13, which was pulled already, 17, 18, 19, 20, and 23. Is that correct?
Correct.
Okay, thank you, Mr. Skane. We'll do that. And anyone else from the public wishing to pull items? Okay, seeing none, then I'll go ahead and read those items minus 13, 18, 19, 20, 23, and 24.
And 12.
And 12 also. Thank you. So item 14 is a resolution levying final assessment for costs incurred by the city to mow and clear overgrown vegetation at 2208 Coventry Lane. 15 is a resolution levying a final assessment for the city to mow property at 216 Iowa. 16 is a resolution levying final assessment for costs to remove a hazardous tree at 1814 Rainbow Drive. 17 is a resolution approving and authorizing execution of a contract with the Governor Safety Transportation Bureau relative to traffic enforcement and efforts. And 21 is a resolution approving and authorizing a stormwater maintenance and repair agreement with property at Lot 7/8 of the Village of Cedar Falls, Block 19. 22 is approving and authorizing execution of 2 temporary easements and settlement agreements for the Mandalay Slope Stabilization Project. Is there a motion to approve these items minus 12, 13, 18, 19, 20, 23, and 24?
So moved.
The motion is there a second? Okay, seconded by Don, I saw. And so this requires a roll call vote.
Harding,
Aye.
Sarah,
Aye.
Sires,
Aye.
Dunn, Miller,
Aye.
DeBoer,
Aye.
all voting aye, Mr. Mayor.
Thank you, Madam Clerk. That brings us back to item, which is a resolution naming official depository for the city of Cedar Falls. Is there a motion to approve?
So moved.
Second.
Motion seconded, and Mr. Steen had wanted to.
I don't know what I hit.
This item. Go ahead, Mr. Steen.
I somehow.
Can you hear us, Mr. Steen? I apologize for that, Mr. Steen. I think that's done. So go ahead, name and address for the record, please.
Tim Skane, 2215 Clay Street. My question about 12.
I somehow hit a button
I would like to
took the sound off of there and put it here.
Which are the official
Is that what happened?
Yeah, can you hear it okay?
Yeah, I'll hear it on it.
I can actually hear it better.
The reason I asked 12B, because it doesn't indicate in the agenda statement what the depositories are.
Okay. So in that, I can certainly say from looking at the items that are listed in the packet itself, so those items
I don't know what I pushed. I pushed something.
Because I lost all the audio from them.
So any other comments from staff on that? Okay, so with that, it's been motioned and seconded for the resolution naming depositories, and this requires a roll call vote.
Harding,
Aye.
Dara,
Aye.
Sires,
Aye.
Sires,
Aye.
We're not muted.
So for Councilmember Sires, we can't hear you. You
Aye.
thumbs up, so it's an aye.
Dunn,
Aye.
Miller,
Aye.
DeBoer,
Aye.
Thumbs up.
Up.
all right. All voting aye, Mr. Mayor.
Madam Clerk, item 13 is a resolution approving and authorizing execution of a water service territory agreement with Iowa Regional Utilities Association relative to providing utilities to customers within an expanded industrial park area. There's our motion to approve this item.
So moved.
The motion and seconded. And Councilmember Sires, I believe you had questions or comments for this item?
Yes, I do. Can you hear me?
And we got you muted again. Let me try to.
Hit star 6.
You are muted.
Can you hear something now? Go ahead. Or no, he's lost.
Okay, can you hear me now?
It's just a moment here.
Susan's going to unmute me here.
I'm trying.
It might have been done in the control booth, but I found it asked to unmute.
You are unmuted.
So, yes,
Okay,
go
can
ahead.
you hear me now?
I can hear you now.
Mr. Mayor,
Anything?
can you hear me now?
Still nothing from you, Councilmember Cyrus.
Well, we're in the chambers. I don't know if people are good lip readers or not, but I'll wait till I get on.
Maybe their phone's muted.
It should be. Is that phone on mute still?
Here comes the tech people.
Tech support on live TV.
You are muted. Press star.
Am I still muted? Can anyone hear me? He's working on it.
Try again, Dave.
Is there anything yet?
You are unmuted.
Can you hear me now? It says I'm unmuted.
Yeah, we can hear it a little bit echoing, but we can hear you.
How about now? Can you hear me now?
It's understandable, so go ahead.
It's understandable. Well, here's my issue. Looks like we have a hostage fee on the property that we bought to increase our industrial park. It would have been nice to know this ahead of time as to spend $500,000 on something that could have been maybe negotiated with the previous owners. It looks to me like this company is just kind of speculating on us, because if you went by farmland, you would not get that many hookups. $500,000 seems like a lot to spend on a hostage fee for territory we bought when I believe we bought water rights with that. And wouldn't it make sense if we could pump water out of our own property? We wouldn't have to pay them their hostage fee. These were some of the things that came up while I was pondering it and went over some of it with my lawyer. But the thing about it is, that seems like an awful lot of money just to say, well, it was a mistake or whatever. I'm just kind of hurtful to spend the taxpayers' money that way. And that's really my comment on the whole situation. We need to, I hate to go down without a fight on $500,000, because that could do a lot of good in the city somewhere else. I hope that was comprehensible.
My understanding of that question, I think I got it, is about that $500,000 fee, and what the reason was that we had to do that, and if there was any information about negotiating with the previous property owner so that we wouldn't have to pay it.
Mayor, I'll start. Oh, go ahead. I'll start, but so my understanding is Iowa Regional Water, the Rural Water Association, we didn't actually know that they were going to claim the rights and until after the property was actually already purchased. Now, Attorney Rogers can give you a much better description of this, but what I can tell you is through the federal law, the rural water associations have a very broad jurisdiction on what they claim for property owner rights, and they've been very successful through the courts in those claims or accusations. So we've got to be very careful on what they actually claim, and then under the same federal legislation, my understanding is the service that they have to provide. So all they have to do is provide potable water service. They wouldn't have to meet any of the fire suppression or any of those type of requirements at the building requirements just because of that. Kevin, I don't know if you want to jump in there and maybe provide a little bit more.
Yeah, it's about federal protection for rural water providers, and when the city comes close to their service territory, and by the way, the city had no reason to understand where exactly their pipes were in the ground because they hold that pretty closely. And so once federal jurisdiction kicks in, we have to deal with that and make assessments about what would be probability of outcome, and we made our decision on that basis. I would add, though, that the same claim would be in existence whether or not we were dealing with the previous owner or not, because the service territory would be the same no matter who owns it. And so it wouldn't make a difference in talking to the folks from whom we purchased the property. Also, cognizant of that, you'll see in the agreement that there's an option in place with respect to property to the south of the annexed property as well, so that at least there's a price set in case the city ever expands there as well.
Okay. So for Councilmember Sires, did that answer your question?
That's fine. I'm just opposed to spending $500,000 on a hostage fee.
Not hearing
a
you
fight.
again.
Thank you.
Mayor,
Yes, go ahead, Councilmember Miller.
we're still trying to get Dave on there.
We are, yeah. We're just not hearing him.
Well, I can wait, but
No, that's fine. Can you still not hear me?
And still nothing. So the chambers are unmuted, but there's just not sound coming in. So it might be the telephone mute button again, possibly.
I just want to say thanks to staff for, this was largely unexpected, I think, from everybody's point of view, and they've been negotiating this for a while, and I appreciate all the work that Rob just mentioned to make sure that we're not faced with something similar or something worse should the industrial park expand farther or whatnot. It's an unexpected.
You are muted.
They've done everything they can to make it as reasonable.
You are unmuted.
And for Mr. Gaines, is this something that we're trying to address in DC? Is that part of our ongoing concerns?
Well, I think it definitely is some of our federal legislative priorities. What I can tell you, and Mr. Rogers is going to know a little bit more about this, is the state legislature actually tried to fix this a couple of years ago, and it was determined it failed, the state legislation, in order to try to fix this to help communities around the state. But their fix failed in federal court, is my understanding.
I agree with that. Also, it's not just Iowa, it's across the country, and there's been municipalities primarily are looking for legislative solutions because I think everybody agrees that's pretty much the only avenue available, and the legislatures aren't eager to move in this area.
And remember, the law is so broad that rural waters just kind of gets to claim an area. They don't necessarily have to be able to prove they can serve that area. They almost get to claim that area, and municipalities then have to prove why they couldn't serve it. Is that correct, Kevin?
Yeah, that's pretty much it. And it happens that this particular utility literally has pipes in the ground across the road. And so that meets the definition of making service available in many cases.
They don't have to, if I may, Mayor, they don't have to actually have a pipe across, onto the property we purchased. They just need to be close. And
adjacent, yes.
And then the courts have backed up that they could feasibly provide it, so they have the upper hand.
As much as we haven't passed this measure yet, I don't want to get too far down into our thinking strategy-wise.
Gotcha.
I have a question, Mr. Mayor.
Yes, Councilor.
Didn't the Rural Water Board vote on this on October 13th at their meeting? Do we know, did they approve it?
They approved it.
Okay. And then, and maybe this is some avenue you don't want to go down, but the way I was reading it, and I also appreciate staff's work on this because this is unexpected, like Councilmember Miller said, and we definitely want to have the water rights here. But the way I was reading it was that if it did go to court, it could possibly cost a significant amount more money. than what we've agreed to, and also with the option to purchase the land to the, I believe it's the south, that this is pretty much for us a good solution so that we don't have to go to litigation and spend a ton of extra money, correct?
Agreed.
Okay.
And I did see Mr. Skeen had a question, and then after that I'll call on last four of 6601. So Mr. Skeen, go ahead, sir. I think I have you unmuted then. You're on. Yes, Mr. Skeen.
Yeah. With all due respect, Mr. Mayor, this is a public meeting, right? It's not a packet meeting. And the response that you give when questions are asked...
Mr. Skeen, this is only for the current item.
I know. I'm talking about the current item because I've been listening very carefully to what's been going on, but frankly, I only get part of the understanding. A quick paragraph that would inform the people of Cedar Falls as to exactly what this means as it is being discussed would qualify the response, because it's a very complex thing, as it has been talked about for this period of time. And the reluctance to tell the people what you're doing is, to me, unconscionable. But and I know if I ask you to tell me what this is, you'll refer me to that fraudulent thing called a packet. But that's what I had to say, because I still don't understand, after all the discussion, exactly what's going on. And I don't think many people do. The people around the table and the people with the books are informed.
That's all. I also see 6601. So name and address for the record, please.
Hello, Rick Sharp again.
Mr. Sharp, go ahead, sir.
Hey, I just want to let you know that there is technical difficulties during the initial comments. We heard IT text or whoever was in the broadcast booth, someone said they hit a button and then everything went chaotic. And out here in TV land, we can hear Councilmember Sires and we can hear Councilmember DeBurr, but you guys can't. So I would think maybe if you could table or take a brief recess to get those issues fixed so those two council members can participate in the discussion. But everybody heard the control room talk about when they pushed the button, they didn't know what happened and what they were doing. So I'm just throwing that out there, that there is something going on that we're not hearing clearly. Thank you.
Okay, thank you. We weren't aware of that here in the meeting. So I'll entertain a motion for a 3-minute recess.
I would support a motion to allow tech support to possibly, see if they can figure out what's going on. Definitely want the people to be able to hear.
Okay, so a timeline or a time frame?
5 minutes.
5 minutes
or less, unless updated by tech support.
Okay, so we can give it 5 minutes. I'd want to make sure people could get back and start up again at a set time.
Motion for a 5-minute recess.
Motion, is there a second?
Second.
Second. All in favor, say aye.
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 Okay, opposed? All right, we are recessed. I have 8:38, according to my computer clock, actually 8:39 now. We will convene again at 8:44. Okay, so we are back. Back up. There's Councilman.
Mine says Chase. Mine Chase is off.
Yep, and I renamed Susan Scott. So here, let me rename Banks too, right?
Oh, okay.
Right? That way you got it? Or not?
Let's put John Wayne on there.
Stop it. That'd be funny. Scott President.
Okay, so
Should have let him.
we are reconvening from our short recess. And Director Rosenbeck is just getting a name change there for council members, council member Sires. And where we left off was in our discussion of item 13. And if you're not actively speaking, please mute your mic for me. Okay, and so looking at item 13, we were in the middle of discussion for that before we had some technical difficulties and paused. I'm looking for any additional comments from the public for this item, and I'm not seeing any. So I'll turn it back over to council if there's any final discussion. And also I wanted to ask Councilmember Sires, were your questions answered? Did you hear that from Mr. Gaines? Or did you have any additional questions? Councilmember Sires?
Oh, no, my questions are all answered.
Okay, good.
Mr. Mayor.
Yes, Councilmember Harding.
Since we had that technical difficulty, I think it would be fair if we could just possibly get a quick 30-second infomercial, as you say, update on what this is, why we did it, and then we can vote. Just so everybody, if they're watching at home, they're all on the same page.
It's all up to speed. That's great. So, Mr. Gaines.
So real briefly, this is purchasing the water rights from Rural Water for the recently annexed property in the industrial park. This is also because of federal legislation and the ability for Rural Water to go ahead and claim properties that they can serve with rural water. One of the complicating things that gets to serving water in an industrial park setting is fire flows, the volume of water, all of those type of things that we need to do. With the water pressure, water velocity, volume, all of those things that rural water would serve, they wouldn't be able to meet some of our building code requirements. So the city pursued actually looking at buying those water rights out from them, as have many cities, not only in the state of Iowa, but throughout the Midwest. So again, because of federal legislation, they are protected and they're allowed to do this and negotiate with cities. And yeah, if you have any other questions, please let me know.
Okay. And then this would result in a payment to the Iowa Regional Utilities Association of about $500,000. So with that, it's been motioned and seconded. If no other council discussion, then this requires a roll call vote.
Harding?
Aye.
Dara?
Aye.
Sires?
Nay.
Dunn?
Aye.
Miller?
Aye.
DeBoer?
Aye.
5 voting aye, 1 voting nay, Mr. Mayor.
Madam Clerk. And that brings us, I believe, to item 18, correct?
17.
17, okay, I didn't circle that, right. So item 17 is a resolution approving and authorizing the execution of a contract with the Governor's Safety Bureau, Traffic Safety Bureau of the Iowa Department of Public Safety relative to funding traffic enforcement and training related to traffic enforcement efforts. Is there a motion to approve this item?
So moved.
A motion and seconded. And open it for Mr. Steen. You had a question about this item, so I'll unmute you, and you're welcome to go ahead, sir.
Yes. Once again, on this one, is that it says it's executing a contract, and relative to funding, and I'm interested in what that funding is, and it indicates what it's to be used for, but what's the source of the funding? And that's the basic question that I have.
Thank you, Mr. Stan. So for Chief Birdie, are you able to provide a little bit of info for that, where the funding comes from, what will be used for?
No,
Yes, very fine.
yeah. The funding comes from the state of Iowa. It's a contract that we do every year, and it's extra dollars to enforce impaired driving, distracted driving, restraint violations, speed and red light violations. And the amount varies each year.
And this year it's what, about 4,500? Is that right?
I believe so. I don't actually have the amount in front of me.
Okay, I was looking at it, it was 4,500 in state funds. Okay, so any other council discussion on this item? Then seeing that being motioned and seconded, this requires a roll call vote.
Harding,
Aye.
Guerra,
Aye.
Cyrus,
Aye.
Dunn, Miller,
Aye.
DeBoer. Aye. All voting aye, Mr. Mayor.
Thank you, Madam Clerk. That puts us to item 18, which is a resolution approving and authorizing the expenditure of funds for the purchase of an air handling system for a fleet maintenance area of the Public Works facility. Is there a motion to approve?
Mm-hmm.
The motion and seconded and open for discussion. So, Mr. Skane, go ahead, sir.
Yes, on this one, once again, it's this air handling system. I'd like to just have that explained, and what is the basic cost for this, the purchase of an air handling system? So I have two questions. What is it that an air handling system is, and two, how much does it cost?
Okay, and looking at that item, it was in the council packet as $79,000, so there's no need to ask city staff about that. But for the question about what an air handler system does, Dr. Troggy would be the person to answer that.
I can, Mr. Mayor. This specific unit, it would provide supplement heat for the shop area or fleet maintenance area, as well as improve the air quality in that location. This item was in the CIP for FY21.
Excellent. So it's been motioned and seconded. Any other council discussion questions? Then this requires a roll call vote.
Harding,
Aye.
Guerra,
Aye.
Cyrus,
Aye.
Dunn,
Aye.
Miller,
Aye.
DeBoer. Aye. All voting aye, Mr. Mayor.
Thank you, Madam Clerk. That puts us to item 19, which is a resolution approving the certificate of completion and accepting the work of Municipal Pipe Tool Company, LLC, for the 2019 Sanitary Sewer Rehabilitation Project. Is there a motion to approve this item?
So moved.
Motion and seconded, and open it for public discussion. Mr. Scanlon, go ahead, sir. I'll try to unmute one more time. Go ahead, sir.
Okay. I'm sorry. On this item, evidently, it's the completion of this work, and I'd like to know what the total cost of the project is and how much is being expended as it's completed.
Point of order.
Miller, is that a point of order?
That is a point of order.
Okay, go ahead.
With all due respect to Mr. Skane, I feel like he's using a different process to control our meeting, and we have a council packet. Almost every one of these questions is answered in the first paragraph of the council packet, but he is unwilling to follow our process, so he's just using a different tactic. He pulled 8 items off of this versus the last time that we did this, he pulled 5 in a row. So I guess, point of order, Are we sending Mr. Skane a council packet?
We are not sending him directly a council packet.
Can we do that?
Well, if we do that, anybody else who requests a council packet can get one as well. And there's several hundred pages.
That's our process, is it not, though? If somebody requests a council packet, they can get one? Is that not accurate?
I'm seeing from city clerk that that's not accurate.
Really?
Well, if with any public record, anyone could request a public record, and of course we have our fee schedule where then you can pay the 10 cents per page if you want a printed, any public record. So in this case, you're right. If someone wanted a packet, a printed packet, they could make that request to our office, pay the fee that we have in our fee schedule, and do that. Now, as the mayor pointed out, it's a few hundred pages, so that gets to be kind of expensive.
And any idea what that would roughly cost if it was, say, a 600-page document?
$60. It's 10 cents a page.
Mr. Mayor?
Yes, Councilmember Harding.
Could we not just print a copy and leave it in the library? Like,
you can't even get in there.
Mr. Skane, I have you.
Well, what about a copy? And I mean, you can make an appointment at the library. I mean, I see Mr. Miller's point is that all these things are addressed in the packet. I find the packet very easy to access and read. I download the packet at 5 o'clock on Fridays or whenever it's available. But I am open to trying to make sure that the public can have access to a copy if they have trouble downloading it. I don't want, so maybe it's something to look at for council to make sure that this is readily available in a location that can easily be scheduled over the weekend to read. Is that?
Would that be acceptable? Councilmember Miller, rather than sending a copy individually, to have one in the public library? We discussed that 2 weeks ago as a potential. It would make it available.
Yeah, I think I mean, if I need to request a copy and take it to Mr. Skane personally, I'd be willing to do that. But there's an unwillingness to follow our process, and I mean that we've heard about that for the past 5 years, and this is just another attempt to do that, rather than Mr. Skane doing the research or taking the steps to get online and find the answers. He's just trying to prove a point in controlling our meeting completely.
Yeah, I would have to say also, I brought this up in the past, in previous years, that it does seem to be a bit of mischief involved here. Now, to answer the question, it's right there in the packet. The sanitary sewer has a taxpayer cost of $55K combined with $250K in community development block grants. The entire thing was $305,000, and that is readily available in the packet. The issue, though, and I don't want to get too much into this for this item, but I don't want to restrict the public's ability or right to bring up valid questions for topics. And this gets into a point of what my role is as the presiding official. I want to encourage questions that are valid. It's difficult to know if a question is going to be valid or not until it actually is asked. So I'll turn it to council for if there's an objection to careful restriction of the topics going forward. Like the question, I don't even know how to do it, honestly.
I appreciate your candor and as well the sensitivity of not restricting the public from getting information. I guess that was my point of Mr. Skane clearly is interested in all of this information, which is readily available in so many different places. So I share your sensitivity that I don't want to restrict the public either, but your comment about the mischief here, this isn't new. We've been doing this, and I don't know what you do about it other than can we send Mr. Skane a council packet, or if I need to request a written one, then I feel like it's warranted for Mr. Skane. He's obviously interested in this stuff, and maybe this is I don't know that this gets into what he wants, but at least the information is available to him at his house.
Right. And we have item 20, 23, and 24 that he's brought up for discussion as well.
I'm not opposed to running through these again or this evening at all, but this isn't any different than what happened the last time we did this. It's just not.
It can easily add half an hour to our meetings.
I'm not opposed to the time either, but the point is he doesn't want to follow our process and continually makes reference that what we do isn't legal and the information isn't available, and
fraudulent.
It absolutely is available.
I agree in many ways. We want to be efficient. We want to be accessible. I still think that we should look at possibly having a copy readily available to the public at any time to make an appointment over the weekend, if that's at the library, because I think that if they do have internet access trouble or just it needs to be there, at least one copy accessible upon request. Somehow, I think that's an important thing, just in case.
Okay, so that could be an item going forward as part of this. And we did deviate from the normal procedure, how we do these discussions, but it was an important thing to bring up, and there wasn't a better time to do it.
Mr. Mayor?
Yes.
I might just add, we do have goal setting coming up, and maybe, I understand that our packets are thick, and just reading what the item is does not give specific detail. And I'm wondering if some cliff notes or something is something we want to look at, but perhaps just rather than at a council meeting, have a discussion about how can we make our meetings more efficient, how can we ensure that the public that has a genuine interest has access without having to read the whole report, because they're pretty boring, some of them. They're hard to understand, some of them. And so just a cliff notes, like I say, of some of the more controversial ones might also help answer some of the public's questions. But I share Councilman Miller's frustration with taking an item and then impugning the character of our staff or elected officials in the process is getting old.
Okay. So I think we've gone through the questions on that item for item 18.
Right.
Item 19. So is there any further council discussion on that? Okay, so motion is seconded and requires a roll call vote.
Harding.
Aye.
Dara.
Aye.
Sires.
Aye.
Dunn.
Aye.
Miller.
Aye.
DeBoer.
Aye.
All voting aye, Mr. Mayor.
Thank you, Madam Clerk. That puts us to item 20, which is a resolution approving the certificate of completion and accepting the work of Peterson Contractors Incorporated for the 2019 street construction project. Is there a motion to approve this item?
Second.
Motion and seconded, and open it for public discussion. So, Mr. Skeen, go ahead, sir. Okay, do we have you, Mr. Skeen? Try to unmute one more time. Okay, yeah, go ahead, Mr. Skeen.
Okay, on a personal note, because I do want to make the point that this is a public meeting. It's not a packet meeting.
Mr. Skeen, I'm going to restrict you to the item listed in the packet, which is the resolution approving the certificate of completion of work at Peterson Contractors for the 2019 street reconstruction project. So do you have a question related to that item, sir?
Mr. Mayor, I was telling you that time and time again, Mr. Miller has had me reduced to see, the point is...
Adam, I'm going to call you as out of order for the first time, sir.
other words, the public doesn't have a right to know what's going on, right?
That is not true at all, and that's why we're here tonight.
Because you're talking about a single packet that I'm talking about all the people in Cedar Falls, not just me.
You're out of order, sir.
I'm not out of order.
That's the second time, sir, because this is limited to the item of item 20, discussing the street reconstruction.
With all due respect, Mr. Mayor, I am not out of order. Mr. Miller is out of order.
Mayor, those comments are for public forum. If there's not anything for item 20, then I ask that we move on.
You're welcome to comment in public forum, Mr. Sking.
Well, there was 23 in there, too.
We haven't gotten that item yet, sir. If there's nothing else for 21, excuse me, 20, we will vote on 20. So any other council discussion for item 20? None? Then this requires a roll call vote.
Harding.
Aye.
Dara.
Aye.
Shires.
Aye.
Dunn.
Aye.
Miller.
Aye.
DeBoer.
Aye.
All voting aye, Mr. Mayor.
Thank you, Madam Clerk. That puts us to item 23, which is a resolution approving a central business district overlay zoning district site plan for facade improvements at 114 West 5th Street. Is there a motion to approve?
Second.
The motion is seconded. Open it up for public discussion. So I see Mason Frome is on this one. So go ahead, Mr. Frome.
Good evening, Council. Thank you very much for your patience.
And name and address for the record, please.
Yeah, Mason from 1922 Grand Boulevard. Just thank you for your patience on this long council meeting. If there's any questions about this item that JD hasn't already covered in the report, I would answer them for you gladly.
Thank you, Mr. Frome. Anything from council on this? Okay, and seeing no other public comment on this item, then or anything else from council, roll call vote. So, Madam Clerk.
Harding.
Aye.
Dara.
Aye.
Shires.
Aye.
Dunn.
Aye.
Miller.
Aye.
DeBoer.
Aye.
All voting aye, Mr. Mayor.
Thank you, Madam Clerk. That puts us to item 24, which is a resolution setting November 2nd, 2020 as the date of public hearing to consider entering into a proposed amended and restated agreement for private development with Strickler Properties. Is there a motion to approve this date of public hearing?
So moved.
Second.
Motion and seconded. I'll open it up for discussion. Is anyone from the public? Yes, Mr. Stan, go ahead, sir.
Yes, on this one, the question about it is that 5G has moved further than it was when this was discussed, and so the idea of
this item is a public hearing for a proposed amendment for private agreement. I think that you're looking at the next one, which is item 25.
I thought 24 had already been taken care of before.
No, sir.
Yes, we're on 25.
Oh, okay. My apologies. I thought I circled 24. So.
Yeah.
I have noted it.
All right. So, where are we at on that then? Have we approved 24 already?
Yes, we did that with the resolution calendar.
Okay. Thank you. Got a little circle happy there. I apologize for that. So that does move us into item 25, which is passing an ordinance amending Chapter 22, Telecommunications of the Code of Ordinances relative to placement of small wireless facilities upon its first consideration. Is there a motion to approve this item?
So moved.
The motion, second? Anyone?
Second.
Second.
Okay, the motion and seconded. And I see for Mr. Steen, we have you. So go ahead, sir. Okay. You were unmuted before, so I'm unmuting you again. I think you might have remuted yourself. Yep, there you are. Go ahead, Mr. Steen.
Yeah. On this one, I remember a couple of years ago this item came up, and the idea of putting these little wireless on the, and I was not sure at that time, whether these were something that had to be for everybody, and since that time, 5G and this kind of material is much different, and it seems to me that this whole placing of these wireless facilities on city poles and like is outdated, and the question that I have is that why do we need these if 5G can be accessed in other ways? And again, it's not clear who would have the expense of this particular process. But I think it's outdated. I really do.
Okay. Thank you, Mr. Steen. This did come up earlier today in our staff meeting with some questions about us being basically mandated or required to offer or have this ordinance by the federal government. So Director Sheets had some good comments for that of why we're moving forward with this. Director Sheets?
Well, as was outlined in the memo back in April of 2019, we discussed at a committee meeting and then adopted guidelines related to how we could guide small cell siting. So these are smaller, these are not cell towers, they're smaller structures that can be attached to other items that help boost wireless connection and provide that 5G service throughout the nation. That's what the goal is. And the Federal Telecommunications Act, as well as state legislation, has basically told us that we have to allow them. But we are able to guide the siting of that in terms of a preference of location. We can say the most preferred is industrial, then commercial, then residential, for example. We can talk about whether they fit in with the context of the location being proposed, whether they might have some kind of disguise to them. You know, we've seen units that are designed like mailboxes or that type of thing. So that's what we can guide, but we are not able to tell them whether or not they can do it because state and federal regulations allow it.
Okay. So, and to answer the question from the cost side, is there any cost to the city on these, or is this entirely borne by the wireless provider?
They have to pay for the cost to provide the small cell that's being proposed.
Okay. So, any other questions from council on this? Okay, so it's been...
Mayor, if I may.
Please, Councilor Miller.
To that point, say a light pole has to be redone or something 10 years down the road and there's one of these facilities on it, who bears that cost? Does that go back on the provider as well?
So it depends on the situation, I guess. If you're talking about a street light pole, for example, there's also provision in the ordinance about attachment agreement, where then they're entering into an agreement with CFU, who owns the pole, and they're covering some of those expenses. But say the pole has to be replaced, it might just be because the pole is old and needs to be replaced. So then, you know, that perhaps is a CFU cost, but they'll have to that cell company will need to remove their facility in order to allow the work to happen. There also in that attachment agreement would be things about whether the pole can support that added weight and some assurances that way so that we don't have a safety situation.
Thank you.
Any other questions or comments from council on this?
Quick comment, Mr. Mayor.
Yes, Councilor Hart.
I spent a good amount of time reading through this, and it's a pretty hefty ordinance. And I know I think that it is in a lot of ways the future because this is providing 5G in the way they get it. I know there's some controversy in it, but I guess I just wanted to say thanks to staff for definitely really covering a lot of bases in there, including some safety things and everything. So I think it's a good step, progressive step for Cedar Falls to make sure we have this ordinance in place.
Thank you, and definitely for the aesthetics, because we've seen some examples around the country of some pretty horrific towers. So our ordinance should resolve that and prevent that sort of things from happening here. So motion and seconded, no other discussion, and this requires a roll call vote.
Harding,
Aye.
Dara,
Aye.
Sires,
Aye.
Dunn,
Aye.
Miller,
Aye.
DeBoer. Aye. All voting aye, Mr. Mayor.
Thank you, Madam Clerk. That brings us to item 26 for allowing bills and payrolls of October 19th, 2020. Is there a motion to approve?
So moved.
A motion and seconded. Any discussion, questions from the public? Comments?
Who was the second, Mr. Mayor?
Was that Councilmember Harding?
Second.
I said something, but I don't remember if I first did or seconded.
Well, she wanted a second, so.
I'll second it.
Okay.
Thank you.
Motion and seconded. No discussion, it looks like, from the public and from the council. Okay, so this requires a roll call vote.
Harding,
Aye.
Dara,
Aye.
Sires,
Aye.
Dunn,
Aye.
Miller,
Aye.
DeBoer. Aye. All voting aye, Mr. Mayor.
Thank you, Madam Clerk. That puts us over to City Council referrals. Do we have any referrals for tonight?
Yes, Mr. Mayor, I'd like to make a referral. We had one of the speakers actually kind of mentioned this, and we're back on electronic. So I was wanting to make a referral to a committee of the whole or wherever we feel it's prudent to come up with a council policy on COVID-19 meeting practices, something that council would approve. Possibly staff could bring forward a few options where we could look at, okay, when are we going to be in person for sure? When are we going to be on the web for sure? Something that's standardized and outlined for the public that's approved by council. I think it would be prudent to look at having that, because this is obviously not going away, and it's a big issue. So that would be my referral. I probably maybe it's a committee of the whole with a presentation on some options, and then we could give staff guidance on which option we have a consensus on.
Well, we don't want to get too much far forward without.
Sorry.
So it's been motioned to have a committee or have staff bring the committee of the whole a proposal for council approval on electronic meeting criteria. Does that sound right?
Yeah, or what would maybe possibly COVID-19 meeting practices.
So policy on, or bring forward a draft policy on COVID-19 meeting practices.
Mr. Mayor?
Yeah.
We had a motion and a vote and a referral to go back to council chambers. So I'm not sure if I missed a meeting where we voted not to go to chambers.
We're still on this motion, Councilmember DeBoer.
Yeah, that's why I'm asking it. You're making a motion for something that we already have.
We can't, Councilmember DeBoer, we can't discuss an item until we've motioned. Councilmember Mr. Rogers, is that wrong? I feel like we need to deal with the motion at hand, and we can have a discussion through that.
We need a second.
Yeah, so that's for what Councilmember Harding brought forward. We had a motion. Is there a second to refer to committee of the whole? Okay, so motion and second. Now, Councilmember DeBoer, feel free to discuss.
Well, what I was trying to point out was we already did a motion and a second and a vote to be at chambers. So suddenly we're not at chambers, but even though we had a vote. So what's the point of making a referral and deciding something when we're not going to go with what we decided anyway?
Okay, open that for council discussion.
Well, I think it was to me, it's been a little bit loose, and we're trying to flow with the times. Originally, I believe on the timeline of this, the mayor had sent out his recommendations, which was 10 or below for in-person. We kind of all said, yeah, that's fine. Well, it never really went below 10, but we all wanted to get back to the council, and we were below 25, so we made the motion, let's get back to chambers. Now it's higher than it has been significantly in some time. So I guess my point in making the motion was I feel like It's not going away. Things are changing. So rather than be this fluid, let's come up with a policy that we actually are going to follow and stick to for sure. And that way the public knows, the council knows, we all know. And so that was my intent behind the referral, was to just get some real solidity here on what we as a council feel unified on, when we want to actually always meet and when we feel like, well, maybe we need to meet via Zoom. Hopefully that explains the intent.
Other council discussion on that?
Can I just say that, and I don't know, I like the discussion, but I feel like we've got the partitions and we've all been compliant in wearing the masks when we're together. I personally feel like that those precautions, I mean, I don't want anybody to feel like they're unsafe, but I personally feel safe and okay to return to chambers.
I guess I feel safe to be in the chambers as well, but do we need a policy here, I guess is what I'm saying. Like, do we actually need to outline something? Is there a point where it would be unsafe? Somewhere, something that we need to make sure we have in place that we're truly going to follow. I personally think it's worth looking at you know, having staff bring forward some options and us give guidance. But you know, if I'm also okay if we don't go that way, but then I feel like it's still loose and the public's not going to know what are we going to do.
Well, and then the option or the follow through on that is no matter what happens, we're always in the council chambers. Like, there is no more electronic meetings under any circumstance.
Don't we still, though, have the option, though, if someone for some reason didn't feel safe, that they could do the Zoom option?
That's not specified. We're doing it now, but there's no, just like with the telephone, what happens if every person wants to call in? Is that acceptable? So it's kind of a new normal for us, and I'm glad, I mean, we're having this discussion. I think it's really important to do. For my role as the presiding official, I try to follow what I believe council recommendation or the general council direction is. In doing this meeting, I spoke with Councilmember Dara as the pro tem, spoke with Mr. Gaines to see if it was advisable or if it made sense to do the electronic, being as our counts were so high. But if council is willing to take ownership of that and say, no, we don't, it doesn't matter what the numbers are, we're going to meet in person, you're welcome to do that, but then it's not my call, it's not my responsibility. And I just want to make sure council owns that.
Mr. Mayor, it gets to the point where if we say, yes, we're back in chambers, and then we never have the Zoom option, or if we have the Zoom option, what if everybody wants to call in? What if people want to show up? I mean, this is why I brought it up. It really comes down, we're at this point in COVID-19 where we really need to have some policies, I feel like, that clearly outline to not only council but to the public what our COVID-19 meeting practices will be. And like Kelly said, we could put in the option, well, we're going to be in chambers unless the numbers are over this. But if you don't feel comfortable, you can Zoom in. Maybe that's the policy. The state does have a policy, I believe, and correct me if I'm wrong, and so does the county because they're wedded to the state, of 50 or more per 100,000, and then they don't meet. And does anybody know about that? There's a high, I don't know if maybe I read it wrong, but I guess back to the original point, I feel like we should really try to put together a policy or spend some time figuring out what the options are, so it's clear cut. There's no more, going back and forth. So
it wasn't as important when we thought that this would only last till like July or August, but now that it could be longer, it makes sense to have a policy written in place that council has voted on and approved. In my mind. And so the motion and seconded to have council or have staff bring forward to committee of the whole a recommended policy. Any other discussion on that? Okay, so is this a voice vote, Mr. Rogers?
Yeah.
Okay, so all in favor, say aye.
Aye.
Opposed? Okay, so I heard all ayes, and that passes. So staff has been directed to bring forward a policy to committee of the whole in the near term, so that we can know for sure what council's direction is there. Any other referrals for tonight?
Mr. Mayor?
Yes, Councilor Miller.
In spite of our conversation earlier, I'd like to make a referral, and I don't know that we need to go to the committee of the whole with this unless that's the procedure, but I would like to see a copy of the council packet available at the library on Friday evening. I believe we've got a copy of city code at the at the reference desk on the second floor. If we can get a copy of the council packet available for the weekend, an appointment doesn't have to be set, but they do have to wear a mask to go in there. So,
okay, so a motion to have a copy of the council packet at the library, and we can vote on anything in council. So, motion is there a second for that?
I'd second that.
Okay, motion and seconded. Any further council discussion? Seeing none, then all in favor say aye.
Aye.
Opposed? Okay, so council, that's a direction to staff to place a copy of the council packet every Friday afternoon after it's published to the public. Put that in there, or provide that copy to the library.
How will that be sanitized, out of curiosity?
that was the point.
How are the other books sanitized and everything else that people touch in the library?
Do you want me to answer that?
Sure.
Sure.
I'm glad to have the disembodied voice directly.
Currently, what we're doing, we have too many items to sanitize everything, and since ultraviolet is not recommended on library materials, and neither are disinfectants that are liquid, what we've been doing is quarantining items for a number of days. As far as council packet goes, if somebody uses it, then technically it would have to be quarantined, but I realize that it's only really valuable from Friday to Monday. So we do have gloves available. We could offer people who want to look through the packet a pair of gloves.
And that would just be temporary until we're past the COVID times, and then it would just be a regular document like any other document.
Certainly. We're glad to help.
Thank you, sir.
Yeah, thank you.
All right. Any other referrals for tonight? Seeing none, then any council updates? So for Mr. Gaines, I see you frozen.
Mayor, I'll turn it over to Stephanie Sheets, who will give a little bit of an update on our resilience plan. And then right after that, Director Olson, who will give us an update on mutual aid response to Dyke last week.
Thank you. So Director Sheets.
Yeah, I'd like to highlight some public input opportunities that are available in the development of the resilience plan. We have a series of 6 public workshops that are kicking off tomorrow, and the workshops include tomorrow, October 20th, is related to ecology, land, and habitat. All of these are from noon to 1:30 each of the days that I'll list. October 21st is water, weather, and urban flooding. October 22nd is energy, mobility, and transportation. October 27th is community cohesion and civic. October 28th is equity, diversity, and wellness. And October 29th is jobs, business, and economy. So the public is welcome to join over the noon hour for any of those. And they will also be available as online self-guided workshops. If you're not able to join at the time that they're hosted, they will be on the project website, which is cfresilience.com, and anybody can go to that and see the topic and see the discussion. There's also a 2-part public survey that will be available online starting tomorrow related to these 6 workshop topics. There has previously been a survey on other general questions, but now we're going to hone in on the 6 topics. And then in November, there will be a town hall presentation that will be done virtually. So several public input opportunities that are coming up.
Okay, thank you. And Director Olson.
Yeah, thank you, Mr. Mayor. On Friday about 11:50 in the morning, Dyke had a building fire in their downtown area. They had a fully involved building, which was right next to 2 other buildings, one being their lumber yard. They made a request for our ladder truck at that time. We sent that ladder truck immediately, and we followed up with a response of 19 firefighters to the scene. We were at the scene just under 4 hours, and about an hour and a half into it, we sent our rescue truck to help fill air tanks. As you can imagine, the backpacks, you have a limited number of backpacks, and that limits the amount of air you need. So we sent that truck to refill the tanks. There's about 5 to 6 agencies involved in that response, and they were, of course, they're led by the Dyke Fire Department, who's in charge of that scene. So it was great teamwork. The damage, none of the adjoining buildings did catch fire, but the other building, the main building that was on fire, was a total loss.
Okay, thank you. And what can you say about what that did for the response posture in Cedar Falls? Were we impacted at all during that time frame?
No. So what we do is when we have an actual fire ourselves that we know it's going to take a period of time, or we have any type of call that we know it's going to take a period of time, we do what's called a callback. And then we have often people come in, they staff the station, and so we're able to respond to other calls with a fire truck. But when we get to this scene, the first thing we do is we check in with the person who's in charge of the scene, which is the site fire chief. And of course, then we take direction from him, and we get our truck set up. We have to hook up the water, initially check the roof of the building to see if there was if it was intact or not, because he's measuring an aerial. He's either going through a window or through an opening in the roof. So, but our city does not go unprotected during those periods of time.
Okay, thank you, Director Olson. So with that, looking at no other staff updates, then we are now open for public forum, and speakers will have up to one opportunity, or have one opportunity to speak up to 5 minutes on topics germane to city business. Does anyone from the public wish to speak on an item? Okay, let's see, Mr. Skin, so go ahead, sir.
Yes, I have 2 things that I want to get across tonight. One is the 6-year harassment by Councilman Miller, who in November of 2019 precipitated Mayor Brown to have me removed. Removed, and I was not doing anything wrong. I was properly recognized, but Public Safety Director Olson and now Police Chief Birdie escorted me from the chamber, and in the process, Mr. Olson injured my legs that became infected, and they're still infected. And I'm saying that the one who instigated it all was Mr. Miller, and he knows that he did. But the point that I really want to make is that I get so sick and tired of the council saying that they are the only ones who can have the information. I mean, you're a public forum, you're a public body elected by the people, and putting out information as you've done, Mr. Mayor. I appreciate it on several occasions tonight. It only takes a few minutes, but if Councilman Miller gets into his tirade, look at the time that was wasted.
Please,
because he accused me of hijacking his meeting, and that's the point. It's a public meeting. It's the council's serving the people of Cedar Falls. It's not the council's meeting. I'll leave it go. Let that go at that. But I have another thing. There is a complete misunderstanding about the nature of COVID. Okay, I can be sitting in my office, and you can be sitting in your office, Mr. Mayor, and you don't necessarily have a mask on, but you might sneeze or you might cough, and droplets might go onto the surface of the desk. And then a staff member comes in for good reason after you have gone, and those droplets are there. And that's what is one of the most difficult parts of COVID. It's not just airborne, it's surface-borne. And the idea that you only have to wear the mask when you're around somebody is contrary to everything you can read or see on the media. It's wrong. 1 minute?
Yes,
okay, that's fine. Because, and I hear your discussion, about when you have to wear a mask and when you don't. These days, you have to wear a mask all the time because you never know when you're going to come up against something that's going to spread the virus. And that's why they talk about it. Just 30 seconds, the silly thing about putting a packet in a library. The library is not open 24 hours a day. And it's okay to have a packet over there, but you're missing the point. You're a public meeting, and you should give the meeting. And frankly, Mr. Mayor, I've been appreciative of your willingness to provide meetings, information. I never have understood what the meaning of Mr. Miller's complaints, because I never hijacked the meeting. Thank you very much.
I see address 6601. I believe that's Mr. Sharp. So go ahead, sir. I think I muted you. There we are. Go ahead, Mr. Sharp.
Hello, Rick Sharp, 1623 Birch Street. I appreciate Director Olson's response, briefly explaining what happened at the Dyke Mutual Aid fire, but I still had some other questions in regards to that. Why did the director, the police chief, and the fire chief feel the need for all three of them to be there? Basically, what did the director and police chief bring to the mutual aid fire that was in our own town? I mean, we're talking our three top public safety officials there. And by having their presence there, I mean, it is a Dyke incident command system. And when you have these young PSOs there, they could be easily confused onto who should they report to when they see their three supervisors or their three department heads running the show there. And I appreciate the answer of 19 people responded. Were these all firefighter one certified firefighters, or were they in training? And I asked that because back when I started,
if we didn't have firefighter one, we weren't allowed to jump on the trucks or even go to the scenes until we were firefighter one certified. So I'm kind of curious about that. And also, how did they all get there? I have reliable eyewitnesses that were at that scene that said they saw Cedar Falls fleet maintenance vehicles, the public works vehicles, and numerous unmarked squad cars. And I guess as a citizen, I'm wondering, is this an appropriate use of the citizens' tax dollars? And is this an appropriate use of the vehicles in general? I've never seen to a mutual aid response fire that we send public works vehicles there. And I don't know if the public works director or supervisors gave approval for that. So it's just, I don't know, it's just kind of confusing here that we're sending all these non-fire related vehicles clearly out of town along with our 3 top department heads to what at the scene, I guess, to be an eyewitness. I would think definitely the police chief would be better off here in Cedar Falls to provide services. And I don't know, I'd appreciate any explanation on that. Thank you.
Okay. Thank you, Mr. Sharp. Director Olson, can you respond to that?
Certainly I can. So the Public Works Maintenance Division, typically Dustin, goes to nearly every major fire scene that we have. The fire trucks have a lot of mechanics to them, and we frequently have, I would say frequently, but from time to time we have a problem and he's there and he can troubleshoot and maybe help fix something if it would occur right away. So that's a very common occurrence. The fire chief would certainly go to a call like that. Well, first of all, I would say that we will respond in whatever way we can to any adjoining city in Black Hawk County to help in whatever way we can. So whether we have 4 going or 19 going or 1 truck or 2 trucks going, it doesn't matter. We're going to respond in any way we can to help them. Makes sense for the fire chief to go. The police chief went to the scene. He's also a cross-trained firefighter, and he suited up and assisted as a firefighter as well. I went to the scene as well. And most everybody that we have in the department here that is a PSO is firefighter 1 or firefighter 2 certified. There are a few that are undergoing training at this time, and a few of them did go to the scene. This is terrific. If it's not just from an observation standpoint, maybe it's from them assisting in whatever way they can, but we certainly want them to help. They've all been through the class, the firefighter 1 class, but not all, I think, were at the scene. I think there were a few that hadn't taken their, or actually they just took their test on Thursday this week, so we don't have the results of those yet. So I think I caught all the questions.
Okay. Yeah, well, there is a question too about the incident command system.
Oh, certainly.
If that does lead to potential confusion and what.
Yeah, so what we do is, well, no, actually, yeah, I understand the question that it could add to potential confusion, but whether it's a fire in Dyke or it's a fire in, you're going to see all those at that. In fact, we had a fire this morning where you saw the fire chief, the police chief, and myself at the scene. But what we do is, I want to try to explain this so it's easy for those who aren't familiar with the fire scenes would know. But in Cedar Falls, they're called 500, which is the highest ranking member of the shift for the day. So they're in charge for the shift for the day. When they get to the scene, they announce on the radio that they are 500, which indicates that they are in charge of that fire scene. They remain in charge of that fire scene unless somebody else takes charge, and then they're referred to as that. So what we frequently do at the scene, as we did this one, we had a lieutenant that was in charge of this scene. All the firefighters at the scene took direction from that lieutenant. So that fire chief at Dyke would have relayed that to that lieutenant, or he could have relayed that to the fire chief who relayed that to the lieutenant. But our guys would have been, guys and gals would have been taking direction from that fire lieutenant. So we do have a method in which people know who they're responsible for. So so there isn't confusion at the scene, because you had 5 or 6 agencies, so each one would take direction from one agency, but those 5 would take lead from the Dyke fire chief.
Okay. All right, I think the other no other public comments for tonight. So with that, I will entertain a motion to adjourn.
So moved.
A motion and seconded. Who's the second? I haven't heard a second.
Second.
Okay, thank you, Councilor. We're done. So motion and seconded. All in favor, say aye.
Aye.
Opposed? We are adjourned. Thank you. Have a good night. Appreciate your patience with the technical issues tonight.